Your heart is not working like it should, and so you are about to undergo open heart surgery that can give you a new lease on life. Whether it's a transplant, a bypass, or any other procedure, surgeons are going to apply every possible effort to ensure that you once again have a heart that successfully sends oxygen and nutrients throughout your body. In so many ways, this is a time for renewal, a second chance to live a robust life.
You scared me. You just stopped.
The recovery and the full life that can follow requires you to be fully informed and prepared for the experience ahead. It also requires you to understand that you will play a significant role in your own recovery. Your actions, your motivation, your family will all come together to ensure good health for the long term.
Now that I'm healthy, I always tell people it's wonderful is if we can walk, talk, and breathe all at the same time, we're doing well, okay?
Patsy Spurlock is living well on the other side of her heart transplant surgery. On a magnificent fall day, Patsy and her husband Jay, along with Fred and Sheila Hardwick, find themselves discussing a subject they know all too well, surviving a family member's open heart surgery.
I felt great. The morning that I had my heart attack, I had walked 2 miles. I had been to see my doctor for my quarterly checkup. The only problem I had was high blood pressure. I went to court and I tried 3 cases, came back to the office about 2:45 and just started feeling bad. No pain.
To get at this stage in their lives, Fred, Sheila, Patsy, and Jay made the decisions to do the challenging work required to fully recover from the effects of cardiac surgery.
If I'd been married to any other woman, I wouldn't be alive today. That's the truth. If it wasn't for her recognizing my emotional makeup and allowing me to do those things I could do and to, in essence, press myself a little bit beyond it to get my strength up, you know, again, I wouldn't have been back to work 4 months from the time I had the heart attack, and wouldn't at this point, you might as well say 9 months later, feel about the same as I did before I had the heart attack, actually better.
The key thing to remember as you prepare to go into surgery is that you will be working through a long recovery. As you know by now, your surgeon, with the assistance of very talented and experienced colleagues, will be opening up your chest cavity to operate on your heart. Your doctor will explain the details for your specific situation. It may be to redirect the blood flow to your heart or repair or replace one of your heart valves. If you need bypass surgery, your surgeon will also use either a vein or an artery from another part of your body to replace your clogged artery. Thanks to the anesthesiologist, you won't feel a thing during surgery. Still, your body will certainly feel the effects after undergoing open heart surgery. You will be instructed when to arrive at the hospital. The night before and the morning of surgery, you will need to wash with a special antiseptic your doctor will give you. Don't eat or drink anything after midnight before surgery. Your doctor will let you know which medicines are safe to take the morning of surgery. After arriving at the hospital, you will be taken to an area to prepare for the operation. Make sure you follow all the pre-hospital visit instructions given to you. Once you're checked in, your caregiver will have a designated waiting area for patients' families. This waiting area will also be your caregiver's center of communication. Your doctor and nurses will be able to let your caregiver know the progress of your surgery. Most surgical waiting rooms are close to the intensive care unit, where you will be taken immediately after surgery. Make sure you let the hospital know exactly who is authorized to receive information via phone or in person. Your surgery will be performed by an experienced team of health professionals. Doctors, nurses, and the entire surgical team have the latest technology and use the most current research. These procedures, while not routine, have been performed, studied, and practiced so many times that the surgery itself is almost always a highly effective way to help get your heart working well again. After surgery, you'll be transferred to the intensive care unit, or the ICU. The technology in the ICU can be frightening for your family if they're not prepared for the sights and sounds this technology makes. The information that is sent to monitors from this technology allows nurses and doctors to respond to any problems instantly with all the tools of their work at their disposal.
Mr. Day, that's okay. It's okay. Hold on. Hold on. You're just waking up. You're just waking up. You've had your surgery. You're in ICU.
When you awaken, your first sensation will be to feel thirsty and groggy. This is normal and won't last long. You'll also find that you now have a breathing tube in your mouth. The anesthesiologist inserts a tube through your mouth and into your throat during surgery. This may feel uncomfortable, but it will help you breathe. You won't be able to talk, but you will be able to communicate by nodding your head. And don't worry, no one will ask you too many involved questions.
My arms felt like big branches of trees. The legs felt like tree trunks. I remember the tubes in my mouth, which were very distressing. I was thirsty as the devil.
Miss Day, I want to bring you on in here in the room where you can be with your husband, okay? I know it's going to be a little scary for you at first when you see him. He's got lots of tubes in right now. He does have a breathing tube in his mouth, and that's the ventilator helping him breathe right now, so he won't be able to talk to you. But I want you to know he can hear you, and I want you to get there, hold his hand. You're not going to mess up anything. There is an IV that's in his hand, and then there's an A line that's in his wrist as well. Okay. But you can hold his hand, talk to him, let him know you're there. We've given him something for pain, so he might be a little bit sleepy right now, but he will wake up, and he'll be comforted by just knowing that you're there. Okay? Thank you.
Mr. Day, your wife's here.
After an hour or so, a family member can visit. It's important for your family members and friends to not be surprised to see you attached to tubes and wires. There will be a nurse at the bedside to explain things to your family. After surgery, your condition will be carefully monitored so your doctors and nurses can get a full understanding of how your recovery is going. You will be attached to a heart monitor. Nurses will frequently check your blood pressure and other vital signs. You may have a line in your wrist or neck to monitor these vital signs. An intravenous tube will provide you with your medication and fluids, since eating won't be possible right away. Since there will be an excess of fluids in your chest following surgery, drainage tubes will be inserted into your chest to remove those fluids. Your urine will be drained by a catheter.
I think he's in some pain. Can you give him something else?
Yes, Mr. Day. Are you hurting?
Remember, you have just undergone a major operation. Pain is a natural occurrence. Don't be brave. Accept the pain relief that's given to you. It will help you to more quickly recover.
I can't get rid of all of your pain, but we try to do our best to get rid of it, okay?
Some pain medication will be given to you orally, and some may be given to you through your IV. If this medication doesn't work, tell your nurse. The best way for you to recover is for your nurse to be as informed as possible.
Hang on, honey. He's going to get something for you.